Hello, functional anatomy students. I had received some positive feedback regarding the videos I did a couple of weeks ago on the back muscles on the anatomage table. So I thought I would go ahead and do something similar on the ligaments and joints of the lower extremity. So what we're going to start with are the ligaments that you can see on the pelvis. Let's start up here. These ligaments here that you can see connecting the lumbar spine to the ilium are in fact the iliolumbar ligaments, both on the right and left. You can also see this ligament here. Oops, sorry about that. That is the anterior sacroiliac ligament. It's on the anterior side and it's connecting the sacrum to the ilium. So you have one on the right and you have one on the left. If you remove those ligaments, there we go, you can see the actual joints themselves. So those would be your sacroiliac or SI joints, where the sacrum meets the ilium. If you continue on down, there's a couple of more ligaments that you can see. Over here on this side, you can see the ischial spine. You can see this ligament that courses from the ischial spine over to the sacrum. So that would be the sacrospinous ligament. There we go. So I just removed the sacrospinous ligament, and now you've got a clear view of the sacrotuberous ligament that's running from the sacrum down to the ischial tuberosity, which is where the sacrotuberous ligament gets its name. Sorry about that. Just trying to rotate so you can see it there. Okay. Over here on the right side, you can still see both ligaments together, and you can see their relationship. Sacrospinous, they're more anterior, and sacrotuberous down below. Okay. Let me rotate our image so that you can see these ligaments from the posterior view. Again, starting up more superior, you can see the iliolumbar ligaments. Here you can see the collection of posterior sacroiliac ligaments. Here you've got a very nice view of the sacrotuberous ligament here and here. Okay. All right. From this view, let's move on down to the femoral acetabular joint. Okay. So here we have a ligament that connects the femur to the ischial portion of the pelvis. It's being stubborn here. I'm trying to remove it for us. Let's see. Okay. So there I went ahead and removed that ischiofemoral ligament. So now you can get a more clear view of the femoral acetabular joint. And you can still see the ligament in place over here, ischiofemoral. So that's the one most clearly seen from the posterior side. If we rotate our image, okay, now we can see a couple more ligaments here on the anterior side. We can see a ligament that connects the ilium to the femur. So that's going to be iliofemoral. And then you can see a ligament that connects the femur to the pubic bone. So that's going to be pubofemoral. And so now you've got a really nice view of, you've got a really nice view of the femoral acetabular joint now. Okay? And the last joint we talked about in the pelvis is the pubic symphysis. So that's where your right and left pubic bones come together, right here. So that would be the pubic symphysis. And The arcuate ligament is not shown on the anatomage table, but if you remember from the pictures given to you as part of your PowerPoint presentation, that ligament would be right here, the inferior side of the pubic symphysis. Okay, so that concludes the ligaments of the pelvis and the joints of the pelvis. So now let's go on down and let's look at the knee. Okay, so now you have an anterior view of the knee. You can see the patella with a patellar ligament that connects the patella down to the tibial tuberosity. Okay. You can see this articulation across here. That's your main knee joint. That's the tibiofemoral joint. And then if we rotate, you can see the patellofemoral joint here. Okay, also from this side, you have a nice view of the lateral collateral ligament that runs from the lateral epicondyle down to the fibular head. You also have a nice view of the lateral meniscus. If we rotate this direction, you start to have a view of the medial meniscus as well as the medial collateral ligament. Let's rotate our image all the way around so that now we have a posterior view. You can still see the medial and lateral meniscus. Okay, so this would be lateral and this would be medial. You can still see the collateral ligaments. But what you can see very clearly now is the PCL. So that's your posterior cruciate ligament. And you can see the anterior cruciate ligament here that crosses in front. Let me rotate this back. If I remove some structures, so if we remove the patellar tendon and we remove the patella itself, you've got a view now of the ACL from the anterior view. Okay. Let's go on down and let's look at the foot and ankle. So right here, we're looking at the talochoral joint, so where the talus meets the inferior, or more accurately, the distal end of the tibia. That's talochoral. That's the joint that allows plantar flexion and dorsiflexion. That's a hinge joint. The other joints you can see here, if I rotate this slightly, you can see the subtalar joint right here. That's where your talus and calcaneus meet. That joint allows inversion and eversion. There are some ligaments in this area as well. The lateral 3 ankle ligaments include the ATF, or the anterior talofibular ligament, right here, connects the talus with the fibula. The calcaneofibular ligament, get a good view of it for you right here, connects the calcaneus with the fibula. And then on the posterior side, you see the PTF, posterior talofibular ligament. All three of those are considered to be part of the lateral ankle ligament complex. If we go back to this anterior view, you can see a ligament right here that's connecting the distal tibia and fibula. We call that the anterior tibiofibular ligament. Don't confuse that with talofibular. Very, very similar. This is the ligament here that's sprained if you have something called a high ankle sprain. That's the ligament that's impacted. Now if we go to the medial side, you'll see a complex of ligaments here, different fibers, but we're just going to call those collectively the deltoid ligament. That's on the medial side. Okay. All right. So we've gone over talocrural joint, subtalar joint. There are a couple other joints that I want to point out to you. Let me go ahead and grab my pen function. I'm going to point out to you the transverse tarsal joint. So that's, I'm going to draw this here. Okay, that's the transverse tarsal joint. So you can see it's where the navicular and talus articulate, as well as where the cuboid and calcaneus articulate. So a combination of those articulation points creates the transverse tarsal joint. Okay. Then up here, that would be the tarso-metatarsal joint. So it's where your tarsal bones meet your metatarsals. Then here would be your metatarsal phalangeal joints. So where your metatarsals meet the proximal phalanges. And then you've got interphalangeal joints, one on the big toe and two on your lateral foretoes. So you've got a set of proximal and a set of distal. Okay? All right, so those are all of the joints that we were asking you to identify in lab, as well as all the ligaments. So hopefully that helped you and will give you another way of reviewing prior to your quiz. Have a great day, everybody.